Hi, this is William Parris with Legitimate Matters. The United States has by far the largest number of COVID-19 cases and deaths worldwide. And the immediate and long-term effects on the health of these at-risk groups are still not quantified. The disproportionate impact in underserved populations has heightened the importance of rigorous studying disparities and translating discoveries into sustainable, scalable initiatives and policies that benefit communities in New York and across the nation. My guest today is Dr. Lynne Richardson with the New Institute for Health Equity Research. Dr. Lynne Richardson is professor of emergency medicine and of population health science and policy at the Icahn School of Medicine at Mount Sinai. Dr. Richardson is a nationally recognized expert in health services research. Her research focuses on access to care and healthcare disparities. Her work has been funded by the National Institute of Health, the Agency of Healthcare Research and Quality, and the Centers for Medicare and Medicaid. We are so happy to have Dr. Richardson on the show. Let's welcome her. Dr. Richardson, welcome to the show.
Thank you very much. I'm happy to be here.
I am so excited to have you here. And as I said in the opening, the United States is now has reported the largest case of COVID-19 cases and deaths in the world. So why do you think that the United States, that is a modern country and a leader around the world, has such a high number of cases? And we have politicians that argue whether or not China was shut down soon enough, or whether it was downplayed to the American people. But aside all of the politics, why, at the end of the day, we have the most cases? Why do you think that is?
Well, I think the key is that we have the most reported cases. The United States is the third largest country in the world in terms of population, after China and India. And so you would expect that we would be in the top three in a global pandemic. I do think that there's a lot of variability in what gets reported in various countries, how records are kept. So you're absolutely correct that while we have the largest number of reported cases, I'm not convinced that we actually have the largest number of cases in the world. Because of these differences in reporting and differences in testing. But certainly the pandemic, as it has been experienced in the United States, I think has been much more damaging than it needed to be if we had made some different kinds of decisions and if different kinds of leadership and coordination at the federal level had taken place. So I don't want to minimize certainly what we're experiencing in the U.S., but I think we may never really know the true extent of the pandemic because of problems with the way tests are performed or not performed, and the way records are kept and statistics are reported.
Completely understood, and that certainly is a fair statement. One of the challenges that we do have as a country are the disparities across America within particular different types of sets. Can you share just a few statistics of groups that seem to be marginalized, and how healthcare and how COVID-19 has impacted those communities and specific groups?
Of course. So prior to COVID and for many, many decades, there have been long-standing inequities in terms of health outcome, life expectancy, disease burden, among certain racial and ethnic groups in this country. And so for Blacks, for American Indians, for Latinx peoples, they bear a disproportionate burden of disease and illness. If we talk for a moment about Blacks, they die more frequently and at younger ages from every cause of mortality that we track and monitor. So across the board, heart disease, cancer, diabetes, trauma. And this really is the result of long-standing inequities that really spring from decades of structural racism and disadvantage. And we are seeing the results of that in every aspect of our healthcare system. What's happened with COVID-19 is that now this very serious infectious disease has been layered on top of these pre-existing inequities. And this really explains to a large extent why Blacks are dying at more than twice the rate of whites when they do contract COVID.
One thing that you pointed out is that Blacks in particular seem to die more frequently from all sorts of diseases and different types of cancer. It's usually, I've often read that different types of cancers and illnesses are more aggressive with among Blacks, and again, they do die from these illnesses as well. So it's just one thing impacting the other. So now today we're talking about the new Institute for Health Equity Research. Tell me about this program. What is this?
So I'm really excited that Mount Sinai recently established an Institute for Health Equity Research, and I had the pleasure of co-directing that with my friend and colleague, Carol Horowitz, who unfortunately couldn't be with us today. And the Institute was designed to address the way that our system has created inequities in life expectancy, in health outcomes, in healthcare for certain disadvantaged groups, and to really understand the causes of these disparities and to identify solutions to correct them. And so we're really interested in action-oriented, policy-relevant research, not simply documenting more of what the problem is, but understanding the causes of the problem, because that is how we will be able to craft interventions to eliminate these health disparities. And the disparities are complex, they're long-standing, they're rooted in systems and structures that will be difficult to change. They involve genetic factors, biological vulnerability, environmental factors, both things in the built environment like air pollution, and things in the social environment like racism and stress, differences in access to healthcare, differences in the quality of healthcare that people receive. So all of these causes, all of these determinants of health are at play in creating these disparities. And that's why it will really take scientists from many disciplines thinking together to understand what has caused these differences that we see and how we're going to correct them. And that's really what the Institute is designed to do, to bring together scientists from different disciplines, clinicians from different medical specialties, as well as community members, policymakers, industry leaders, so that all of us can think together about how we are going to change the nature of health outcomes for Blacks, for Latinx people, for American Indians, for patients who might have a certain sexual orientation or gender identity, for those who are socially or financially disadvantaged, for people with disabilities. So across all of these platforms and all of the disease silos and all of these kinds of disparities, the Institute is going to work to really create the evidence base to change, to create transformational change in health outcomes. So that's our mission.
Well, this is really awesome, and this once again speaks to a political disagreement, depending upon which side is arguing the case that unfortunately the United States is systemically racist, or there is systemic racism within the United States, and these are the types of facts and realities that underscore this particular reality. But what did COVID-19 raise this red flag? Because as you said, these types of disparities have been going on for decades. But did COVID-19 sort of raise that flag that said, you know what? Now is the time for us to really address it, because it's so widespread and it's so deep, and so many people are losing their lives because there just has not been enough unity in the country to admit that this is a problem and then to put plans in place to address it.
What the COVID pandemic is doing is shining a spotlight on these pre-existing underlying inequities. And because of the stark differences in the number of Black and brown people who have been dying from this disease, it has become impossible to ignore. And so people who may not really have been aware of health disparities, or what the nature of these inequities and health outcomes may be, are now having it put in front of them by the media every day. And so I think this really has raised the level of awareness, and people now are asking why. Why is this true? Why are certain groups being affected so differently? And it's really uncovering a lot of information that has always been available, but has not gotten the attention that it deserves from the media, from the public, from our policymakers, and so on. And so I think it is shining this spotlight and makes it impossible to ignore. And I think the other confluence of events that has made a difference really was catalyzed with the murder of George Floyd. Now that also is not a new situation for a Black person to be murdered by police. But because of COVID, we were all home. We were all watching the news. We were following what was happening in the world. And so the number of people who sat and watched on the evening news a Black man being murdered by a white police officer was, a phenomenon that really had never happened before. And I know that these events are often experienced in the Black community, and there's
Absolutely.
a lot of scrutiny within the Black community when these things happen. But this time, because of COVID, because so many people were home, because so many people were paying attention,
around the world, that now suddenly this was put in front of everyone in a way that is very hard to ignore. And so I have been seeing, as a result of this, the outpouring of real attention to the role of structural racism in the United States. And as a health equity researcher, I've been talking about things like structural racism for, 20 or 30 years. But now I am hearing words like structural racism coming from, the mouths of CEOs of Fortune 500 companies. And they're using terms like white privilege. And so the public conversation is different now, I think, than it's been. And I hope that this may be a pivotal moment in our society where we're really going to start to deal with these issues. And the Institute for Health Equity Research has an important role to play in that, because it's really, now that people see what's happening, now that people acknowledge
these stark differences, that there are some people who are living sicker and dying younger and suffering unnecessarily from diseases. How are we going to fix it? And what we are committed to doing is to find evidence-based solutions that will really change those outcomes and eliminate these disparities. And so I think it's an exciting opportunity, having really committed my professional life to this, to now be given this platform to do this work is really very exciting.
This is a huge project that expands far beyond New York City or one particular or even a group of communities. This is a nationwide issue that needs to be addressed. How is the Institute for Health Equity Research positioned to take on such a project of such magnitude?
Well, I think, again, it is the whole approach of bringing together different kinds of experts and all of the necessary stakeholders to understand all of the root causes of these health disparities. And in some cases, the causes of the causes, that we have to drill deep if we really want to figure out what can be done about them. And so you're right, this is not a problem that is confined to New York City, but New York City is the ideal place to start to study how we can implement solutions in our diverse communities. We have some of the finest healthcare systems in the world, and so if we can model how you go about transforming care, for example, in an academic healthcare system so that everyone receives equitable care. If we can make sure that everybody has the same level of access, that everyone receives the same quality of care, then we will really start to move the needle on these outcomes. And so we are doing this very intentionally, again, driven by data, seeking to create evidence, thinking always about not just what have we discovered, but how do we implement it? And when we find interventions that work, how do we scale it? And how do we replicate it across the country? And so that is very much our mindset, that we're not just trying to fix health outcomes in East and Central Harlem, although we're very committed to doing that, but also how do we make sure that we export those solutions to communities across the country and help implement them.
Absolutely outstanding. I'm so excited about this conversation. It's so long overdue. We're going to go to break, Dr. Richardson, but when we come back, we're going to drill down a little bit more to those specific groups and how they've been impacted. Loving the conversation. Viewers, I hope you love it as much as we are loving it. So we're going to take a break and we will be right back.
Our health and the health of our family and friends is affected by many things. These things include our jobs, transportation, neighborhoods, housing, and more. Just think, if you don't have a good job, how can you buy healthy food? If your neighborhood doesn't have a safe place to play, how can you get enough exercise? We want to prevent these factors from holding people back. We want to build a world where everyone has the same chance at living a healthy life. Help us imagine a world like this by sharing art with the National Academy of Medicine.
I live in a state that tried to defund organizations like Planned Parenthood, and most people that come into our health clinics that I talk to every week are women of color.
So I've had the opportunity to go to the North Carolina State Legislature in an attempt to advocate and educate our legislators, many of whom are older white males, and the policies that they are determining, I think, have a disproportionate impact on younger women and women of color.
It's really unfortunate that people in the legislature, these are not their experiences. So to them, they're just like, oh, who really needs it? Who really uses it? And it's like a lot of people.
They're not hurting them. They're hurting people like me. It's just another way to keep Black women and other women of color out of something that we deserve.
And it seems as though they're interjecting their politics and to the type of legislation that's passed in the state in a way to really provide discriminatory care.
75% of our patients here in South Carolina don't have health insurance. And most of those women are people of color, or women of color, families of color. The people that are going to be affected by the defunding are the people that need us, the people that we touch in our communities every day.
There's a way to stop the spread of coronavirus. There's a way to protect others. There's a way to keep your family safe. New York figured it out. The answer weighs less than an ounce. It's not a heavy lift. Be New York tough. Mask up, America.
What do you wish for? A nice life? Nice things? Or do you wish for something more? A sense of purpose? Do you wish to discover a cure? To write code that cracks an unsolvable question? To further our exploration into space? Or to invent something that changes everything right here on Earth? Well, if that's your wish, make yourself ready. Because when you look back, you'll see that you didn't just make wishes, you realized them.
Welcome back to Legitimate Matters. I'm your host, William Parris. I'm here having a wonderful discussion with Dr. Lynne Richardson with Mount Sinai and the new Institute for Health and Equity Research. Dr. Richardson, when we went to break, we were talking about really the need for health disparities to be addressed, and the discrimination across the country and how that impacts marginalized groups. Can we drill down a little bit and talk more about these specific groups that have been impacted by COVID-19, that have pre-existing conditions? And considering each group has unique circumstances and unique conditions, how will the IHER formulate specific actions that will thrust the program forward and sustain these efforts in order to address these groups?
Well, you raise a very important issue, William, and that is the issue of how do we actually tailor solutions for different groups, different populations, and different communities, understanding that often the conditions that lead to poor health outcomes are very specific to local conditions. And so the interventions also have to be customized for individual groups and sometimes even for individual neighborhoods. And that's why it's so important to really understand what the underlying causes are, and then to implement solutions in a way that actually reach the people who are most at risk. So we've talked about the racial and ethnic groups who are really suffering under COVID. Those are Blacks, American Indians, and Latinx peoples. And within those racial and ethnic groups, there are particular subgroups that are at higher risk, and particularly people who have chronic diseases like heart disease, diabetes, hypertension, kidney disease. They are at higher risk from having poor outcomes from COVID. They're more likely to die from COVID. And we know that these same diseases, heart disease, kidney disease, hypertension, diabetes, these are all disparities conditions which disproportionately affect Black and Latinx peoples. And so we really need to understand how to protect the people who are most vulnerable and at highest risk. And in addition to the medical conditions that make people vulnerable and put them at risk, there are other aspects of their lives that put these groups at risk. These groups are more likely to have jobs that expose them to risk. They're disproportionately represented in groups like food workers and healthcare workers and public transportation. So these are jobs that put them at risk because they have to interact with the public. These groups are more likely to have low-wage jobs that don't have paid sick leave, and so they have to go to work if they want to get paid. And so we really need to understand what are the special things we have to do to protect people who are most at risk. I'm an emergency physician, and I was so gratified by the outpouring of public support and gratitude that we got as frontline workers in the emergency department. I took
Absolutely.
with COVID, both at Mount Sinai Hospital and at Elmhurst Hospital Center, one of our teaching affiliates. And it was an amazing outpouring of gratitude. We were, praised as heroes.
Heroes.
But so too are the bus drivers who are driving the buses and the
MTA workers.
the folks, the folks in the grocery store who are there, checking out our groceries so that we can get food, and the delivery people who are delivering those meals and groceries to people who can stay home and protect themselves. And it's not just the doctors and nurses that make the hospital work, but our techs and our aides and our housekeepers and the transporters and all of those people that are involved in delivering healthcare. And so, again, often when you look at the racial and ethnic makeup of these kinds of jobs, you see these racial and ethnic disparities. And so these groups often don't have jobs that you can do from home and telework. And so the financial impact also of COVID can't be understated. People lost their jobs, they lost their health insurance, they're worried about how to provide food for their families, how they're going to pay their rent, how they're going to buy the medications that their grandmother needs. These are all disproportionate things that are happening and affecting certain populations that already had poor health outcomes.
I would like to point out that even as you're mentioning these things and you're talking about people losing their jobs and struggling with health care, I just want to point out that in the midst of all of this, our elected officials, regardless, both the left, the right, the Republicans, the Democrats, while people were suffering, they were on break during the summer. They were on break. And to me, I find that to be completely unacceptable and just horrific. And it speaks volumes to the self-serving agenda of our elected officials that allow this to happen while they take breaks. And they themselves they don't have to worry about health care. They don't have to worry about food. They're set. They don't have to worry about education. But the people in the communities that we are talking about in this conversation are suffering while they fight and brawl in Washington. I had to point that out.
I think you're right. There's certainly tremendous suffering. And, as someone who really has not had a break and who I went to work every day through the peak of the pandemic because that's the job I chose and that's what I committed to do. And I think there are a lot of people doing that. I'm glad you mentioned schooling because I have colleagues and staff who are really struggling with how to make sure that their children are continuing to be educated when they're attending school remotely. And they're finding this to be a tremendous challenge. My question is, what is happening to, the children of parents who are not well educated, who don't have resources, who don't understand how to use these remote devices? What's happening to the education of those children? And these are children who are already disadvantaged in so many ways. So the impact of this pandemic is so far reaching that it's going to take a lot of work to really understand all of it and to figure out how we're going to address it and what we're going to do differently as the pandemic moves forward, or for the next time there's this sort of public health emergency. We've learned a lot of things that hopefully we can implement to protect the people who are at greatest risk. And it operates at all levels: individuals, families, communities, organizations, healthcare systems, local government, state government, federal government. At every level, there are things that we need to be doing, actions that need to be taken to really address what's happening in our communities.
You have an initiative called Speak Up on COVID-19. Can you tell us about that?
Yes, I'd be happy to. So Speak Up COVID was one of the first projects that we launched as the Institute for Health Equity Research. And we did this in partnership with more than 100 community-based organizations and researchers and organizations, advocacy organizations, to really try to understand the impact that COVID-19 was having in our communities. And so we launched a survey across New York City in 11 languages, asking about what was happening with people in terms of their health, but also the psychosocial impacts of the pandemic. We ask about social determinants and trying to understand how that affects people's risk. We ask people what kind of resources do they really need, and does that differ by neighborhood? We ask them, do you know someone who was hospitalized with COVID or who died of COVID? And again, how is that impacting your physical and mental well-being? And so it's we think an important survey. We worked with our community partners to construct the survey because we wanted to make sure that we asked the questions that they wanted to know, not just the questions that we as researchers wanted to know. And we launched this a couple months ago. We have more than 2,000 responses so far, and it's still out there. And so I encourage everybody go to www.speakupcovid.org, and you can download the link to take the survey. So we encourage everybody to do that.
Well, I will certainly put that up so that viewers can see that. Now, I believe you have, you said that you have over 2,000 participants already, and I read that you have a goal of 10,000.
That's right.
That is awesome. And of course, you just mentioned how people can get involved. Are there certain qualifications for participation?
None at all, but we have worked with our community partners to try to get the survey to people who might not typically answer surveys or have access to the internet. So in addition to the website, there's also instructions on how you can text to get a link to the survey for people who may not have high-speed internet access. And we have also, there are paper copies of the survey available that some of our community-based organizations are actually administering to people who might not be able to read the survey. So our dissemination our dissemination strategy really focused on getting the survey to the most vulnerable populations in New York City, but anyone can take it, and we get information about where you live and what kind of job you have and so on, so we can really understand what are the differences and the challenges that people are facing.
This is awesome. We're about to go to break. I think I have about another 1 minute. So before we go to break, are there any other initiatives in place that we should know about that IHER is doing right now?
Well, we have a number of projects that we have already launched. really in response to what we were hearing from community members, one of the things we're working on is to develop community-based, peer-led strategies to help improve the emotional and mental well-being of folks who have been most impacted by COVID. Already just looking at the preliminary results from the survey, 75% of people have symptoms of anxiety.
Oh, for sure.
50% have symptoms of depression, and 40% have symptoms associated with post-traumatic stress disorder. So what we're really dealing with here is community trauma from the pre-existing inequities, from the impact of COVID, overlaid with police violence and this new public conversation about racism. And we are trying to identify what are the interventions that we can develop that will help people deal more successfully with these extraordinarily stressful conditions. We also have a big initiative focused on healthcare delivery and really making sure that the healthcare that is delivered in our system is equitable. We're developing a disparities dashboard that will really let us drill down and track exactly what is the quality of care that we are being delivered. And again, then identify what are the interventions, what are the underlying causes. Is it a lack of knowledge? Is it ignorance? Is it unconscious bias? Is it structural racism? Is it cultural incompetence? To really understand the underlying causes and then to implement solutions to address those, and then to monitor it to make sure that we are continuing to deliver equitable care. And again, we hope this will be a blueprint that all healthcare systems across the country will follow to really understand how they can uproot the structural racism that is embedded throughout our healthcare system and make sure that we're delivering high quality care to everyone, regardless of race or ethnicity.
Wonderful. We're going to, I love this. I'm really excited. This is so desperately needed. We're going to jump right into another break. And we're going to finish this conversation because there's so much I'd like to cover, but this is really exciting news. So we will be right back. Viewers, I hope you're enjoying this conversation. Please stay with us. We will be right back.
Doesn't see race. Love is love.
Worried your friend's struggling but don't know how to reach out?
You could say how are you or get a fake tattoo. You could ask with an app if it works for you. You could write them a text or knit them a sweater. If you can't be together, you could write them a letter.
Whatever gets you talking. Whatever gets you talking.
You could chat on the game, kick off your flip-flops. You could ask on your couch while you binge watch. However you do it, you gotta ask a friend. And if they don't share, you can ask again.
Whatever gets you talking. Whatever gets you talking.
There are a lot of ways to reach out to a friend about their mental health. Learn how you can help at seizetheawkward.org.
Yo, what up, Dogs? Paul Rudd here, actor and certified young person. A few days ago, I was talking on the iPhone with my homie, Governor Cuomo, and he's just going off about how us millennials need to wear masks because, get this, apparently a lot of COVID is transmitted by us millennials. No cap. So Cuomo's asked me, he's like, Paul, you gotta help. What are you, like 26? And I didn't correct him. So fam, let's real talk. Masks? They're totally beast. So slide that into your DMs and twitch it. Vibe check. Yes, queens like ourselves. We want to go to bars, we want to drink, hook up, do our TikToks. I get it. I'm not gonna preach at you like some celebrity. Ugh. This is a combo where I talk and you shut up and wear your mask. Hello? Oh, hi, Billie Eilish. What's that? You're wearing your mask? Man, I want to stan you. You're so my bae. Yo, listen, hype beasts. Masks protect you and your dank squad because caring about other people is the new not caring about other people. Now that's thick. Masks. You want a challenge? How about a stop the pandemic challenge? What about that? What about a save grandma challenge? That fun enough for you? My name is Paul, and I'm 6 feet tall almost, and I wear my mask, and it's all I ask that you wear your mask. Please wear your mask. Just wear a mask. Just wear a mask. It's easy. It's simple. Please. It's not hard. People are dying. Hundreds of thousands of people are dying, and it's preventable. It's preventable. Just wear a mask. I shouldn't have to make it fun. It's science. It's science. No! Look at us. Hey, look at us.
Look at us. Who would have thought wearing masks would be a problem?
Not me. We gotta yeet this virus. Oi.
Welcome back to Legitimate Matters. Once again, I am your host, William Parris. I'm here having an urgent conversation with Dr. Lynne Richardson with Mount Sinai and the new Institute for Health Equity Research. Dr. Richardson, we've been talking about all things related to health disparities, not just in particular communities in New York, but across the country. Well, I would like to ask that, considering the politicalization of COVID-19 and the controversy over vaccines, many Americans are saying that even if the government said that there was a vaccine available, they're not going to take it. So what are your thoughts on that? And how will the IHER address the resistance that so many Americans are feeling in terms of trusting the government? Because even the CDC has been put under pressure by the current administration. So now, once upon a time, the CDC was the go-to for health advice and recommendations. But now we don't know who to trust.
Well, I think you're, again, raising a really important issue. I think, the mistrust of many members of our community for the healthcare system and for research has been earned over, there is a legacy of, again, racism and inequity. And so building trust is something that those of us who do this work in the health equity space do very intentionally, and trust is earned. It is not something that is freely given. And the relationships that we have established with many of our community partners are are really something that we have built over decades of work. But I have to say, as a clinician and a scientist, that the return to normalcy, the return to the way we lived before COVID, that the pathway to that involves widespread acquisition of the vaccine, of a safe and effective vaccine. Now, unfortunately, I think you're absolutely right. Even some of our most cherished and respected sources of information have been politicized. I'm very concerned with some of what is happening or may happen in the development of vaccines. And let me just say that developing a vaccine is something that takes time. And right now, there are literally thousands of groups actively working on developing vaccines around the globe. A huge investment in resources to try to develop these vaccines. But there is a pathway that is required to test these vaccines in clinical trials to make sure that they're safe and to make sure that they are effective. And so it's going to be very important that we pay attention to what might be called shortcuts to pushing some of these vaccines onto the market before they have gone through that scientific process of clinical trials so that we know they are safe and effective. And so this is something that we're certainly watching very closely. We will be, continuing to talk to policymakers. We want to be certainly a source of reliable and trustworthy information about what's happening with vaccines, but there will come a time when we will be encouraging, especially those vulnerable populations who are most at risk, to take a vaccine because there is evidence that it's safe and effective. But I do think it's possible that there will be vaccines that are approved through various pathways that are pushed onto the market before they've gone through that rigorous testing. So we're going to be watching this, and we're going to be speaking very publicly about when is it time to take a vaccine and which vaccine actually has the evidence that you can rely that it's safe and effective. But vaccines are part of the path back to normalcy.
I can certainly appreciate that vaccines are a path back to normalcy, but I'd like to really emphasize and underscore what you've said, which is following the science and that understanding that there are scientists and organizations that are qualified to test these vaccines before they hit the market. And I personally would caution anything that is mentioned that comes from any politician that is based on a political agenda, because at the end of the day, it's about, unfortunately, in politics, power and money. And any politician that that downplays or would suggest that science is secondary to a political opinion, I think is irresponsible. So it's important for us to, again, follow the scientists, because it's the scientists and the doctors that have years of education and experience and the trials and the errors, and they are the ones that are leading us in the direction that will be safe, so that the clinical trials will have already taken place, so that we can trust what the medical institutions are telling us, as opposed to being confused with mixed messages from politicians.
I think you're right. There are a lot of competing agendas, not just from politicians, but also by the companies that are developing these vaccines. As I said, they're investing huge amounts of money, and so the risk that they will find ways to sell these products that they have invested millions and millions of dollars in developing, even if it turns out that their vaccine is not the best vaccine, is a real threat. And so we just really have to pay attention to that. I do want to encourage people, though, people who feel comfortable and who are interested, that we do need to have diverse representation of subjects in these clinical trials so that we can know that these vaccines are safe and effective for all groups. And if you are approached about a well-designed clinical trial from a trusted source, you certainly should consider that. But I think it's hard for the public to know, as you say, really who is telling the truth and who has an agenda. I'm not sure I'm quite as cynical as you are, William, that all publicly elected officials are not to be trusted. I think some of them really do have the interests of the community at heart. But it's really unprecedented, the kinds of statements that have come out from various quarters, both at the federal level and in some cases at the state levels, where you're right, politics is superseding science, are really just shocking and really appalling to me as a clinician and as a scientist and as someone who's dedicated to health equity. So you're right, we really have to pay attention.
I want to ask on the conversation or on the topic of politics, there is a strong possibility that the Affordable Care Act, depending upon as we look down the road, it could be completely dismantled, leaving millions of individuals without health insurance, and those that have pre-existing conditions could be also at risk. I mean, their very lives could be at risk. How will such an action impact your efforts?
Well, I can't really explain to you, William, why anyone would be considering dismantling the Affordable Care Act. This is a legislation that has created programs that has cut the number of persons who are uninsured in this country in half. 20 million people now have insurance and access to care who did not have it before. It has had a positive impact on their health outcomes. It has a positive impact on their financial security, because healthcare costs, medical bills, are the leading cause of personal bankruptcy in this country. The provision that does not allow insurance companies to exclude you due to pre-existing health conditions has saved literally millions of lives, so that people who previously could not get insurance now can get insurance and can get the care they need. Small businesses have benefited. And so it's hard to understand who it is who is interested in dismantling something that has been that has improved health outcomes, that has improved people's financial status, that has improved the stability of small businesses, that has helped people get care they need, that has made sure that providers and hospitals get paid for taking care of people who most need care. It's hard to understand who it is who wants to dismantle this and why. But certainly we will continue to produce evidence of the positive impacts that people having access to health insurance and having access to health care make. Will continue to generate the evidence to provide to our policymakers and legislators so that they have ammunition to really try to refute the just fantastic statements that are being made by people with ideologies that really don't seem to value all individuals equally.
So before we completely, I thank you so much for saying all of that, because though for me personally, I find that a real hot button, And of course, in this show, I've said things that are my personal opinions, but I also believe that my opinions are shared by millions of Americans. But I think that the program that you and Dr. Horowitz are co-directing is an outstanding program that is so long overdue, and I so appreciate the effort and the energy and the outreach that the two of you have initiated. So, how do you see your forecast over the next couple of years, and how will you measure the success of your program?
Well, again, we have a very ambitious set of goals and objectives. We're launching multiple programs, multiple research initiatives, and multiple implementation initiatives. We've had a very generous investment in the Institute by Mount Sinai to get us started, but we will have to continue to seek additional financial support for the Institute. Carol and I both have a long history of being funded by the NIH to do research, and we will continue to write grants and seek funding from those sources, as well as hopefully to attract some philanthropy. But we are, again, action-oriented and data-driven. And so we are setting up in sort of each of the domains of the Institute's specific objectives that we want to accomplish. We're going to be monitoring the impact of what we do. Again, we're not interested in just doing research for the sake of research and publishing it. We're interested in doing research that helps us understand how we're going to change the way we practice medicine, the way we care for people, the way we address people's needs, and make sure that everybody has access to all of the things that are required for good health, that they have access to, medical care, to clean air, clean water, safe housing, everything that's required, nutritious food, everything that's required to optimize their health.
And on that, we will wrap it up. Dr. Richardson, I am just reaching out to you. I'm giving you a virtual hug for taking time with me today and being my guest on Legitimate Matters. The information that you've shared is just monumental, and it's so important that viewers understand that these types of programs are in place. So to you, and also to Dr. Carol Horowitz, your co-director, who was unable to attend the show today, I want to just extend my sincere appreciation, not just for being on the show, but also for the work that you're doing to make a difference in our communities across the country. Thank you so much.
Well, thank you for this opportunity to talk to your audience. Take care.
And for viewers, I also want to thank you for watching Legitimate Matters. I'm your host. Don't forget to follow us on social media. At the end of the show, we'll post that up. Thank you for watching. We will see you the next time. I'm William Parris. You've been watching Legitimate Matters.